Miss your voice, miss your smile, everything about you worth the while. Always wondering where you are. I hope you're with us, near or far. Many questions unanswered.
Hi, my name is David Lubofsky. I'm the father of Asher Dean Lubofsky, and you can look up on the internet all about Asher Dean Lubofsky and what happened with him due to medical negligence. Anyways, this is the second of a series on Guam Medical Corruption, and this one's really easy to get through. It won't take as long as the others, and it's more clear cut. This time we're going to be talking about featuring on our medical corruption series Dr. Cabrera. Dr. Cabrera was just awarded a contract by the governor to be the head of public health in a position that pays him $238,000 per year. $238,000 per year. Now, this is interesting because Dr. Cabrera has been on the governor's advisory committee ever since the whole COVID thing started, and he's been the advisor in the meetings behind closed doors. He was one of the people that behind closed doors discussed the need for lockdowns and everything else that are not successful. And he also is one of the doctors that predicted that we would have 3,000, imagine that, we would have 3,000 deaths on Guam and so forth. Also, the most important thing about Dr. Cabrera is this. Dr. Cabrera last year gave testimony at the Guam legislature, which you'll see coming up, that stated that Guam's patients, Guam citizens, you, I, Asher, your children, all of the people that we love, should not be able to sue doctors for medical negligence. His statement in his testimony, which you'll see, is that we should not be able to sue. He can sue for medical negligence when a doctor kills or hurts us. That was Dr. Cabrera. And Dr. Cabrera was also running the Guam Regional Medical Center. At the same time, had many complaints and issues of medical negligence there. Let's not forget the story of baby Faith that died due to medical negligence, allegedly, at Guam Regional Medical City on Dr. Cabrera's watch. Let's not forget the Mr. Lagrimas, if I'm saying his name right, that was in the Guam Regional Medical City for a year, and his daughter alleged medical negligence, and gave testimony at the Guam legislature the same day as Dr. Cabrera. And because she gave testimony at the legislature, from what she says and from what it appears, she was given a hard time and even blocked at one time from seeing her father, who was in the hospital there for a year before they came up with some arrangement to get him off island. And let's not forget that many other people, including Charles, and there's been other medical negligence cases at Guam Regional Medical City. Anyways, Dr. Cabrera is going to be working with the most, at public health, he's going to be working with the most disadvantaged on the island, economically, due to disability, due to age. That's what that position who has him interacting with. In his only 40-hour-a-week job, he'll be earning $238,000 to interact with the poorest on the island. And those people, he feels, by the testimony coming up, that they should not be protected at all when medical negligence happens. They should not be able to go into court, and they should not do away with the Mandatory Malpractice Arbitration Act, which protects doctors and which hides doctors who hurt us. He feels that these people, including the whole island, should not be protected. You can watch his testimony now. And this is the doctor that they put in charge of the poorest people on the island, who doesn't think the poorest people on the island should be protected for medical negligence. It's really unbelievable, especially with the history of Guam Regional Medical City while he's at watch and some of the things that happened there. Just give a watch here. Thank you.
I want to start by acknowledging that there are a variety of opinions regarding what medical malpractice actually is and what is its intended utility. The same goes for the Mandatory Arbitration Act and what both are ultimately costing us as a society. I personally am no expert on the legal topic, but I know enough to recognize its complexity. To help understand the complexity, at least for me, I will offer two eye-opening statistics which directly conflicts with the sentiment that perpetuates much of society regarding medical malpractice. When discussing a topic that can be quite emotionally charged, it is especially in these situations that we must take pause and seriously look at what the science is telling us and how it helps us balance a human need. But before doing this, it's probably best we start by better understanding what the purpose of the medical malpractice actually is. So upon its inception, medical malpractice lawsuits were not intended, nor were they designed with the goal of punishing healthcare providers that harm patients. Yes, this was never intended to be a form of punishment for punishment's sake. The actual purpose of malpractice lawsuits is to make the patient whole that was harmed, as if the interaction never happened. It is also intended to incentivize providers to take appropriate precautions against avoidable harm. So looking at the actual definition of medical malpractice gives us further insight. It is defined as a breach of duty or deviation from the standard of care leading to harm or injuries to a patient. This does not include poor outcomes or damages alone. Yet all too frequently, those who have poor outcomes believe that it's because of life's unfairness, that it's someone's fault and someone must be at fault. All too frequently, we are quick to assume that if contact occurs with a medical provider in the process, that they must have been in some way, in some manner, derelict of their duty. We can all empathize with this understandable human reaction, especially in a time of grief. I'm sure we can understand that bad things happen as a part of life, and it doesn't always mean someone screwed up. The biggest irony about medical malpractice can be summarized in the following study. Prior to tort reform implemented through most of the country over the past 2 or 3 decades, a landmark retrospective study published by the Harvard Medical Practice Study showed that 1 out of every 15 patients who are actually injured due to medical malpractice ever receive any compensation that will help them become whole. 1 in 15. An astounding 5 out of every 6 lawsuits, which results in some form of payment, mostly a settlement, have absolutely no evidence of actual malpractice. Again, a retrospective study looking back. So let me put these statistics in an analogy that helped me better contextualize this data. So let's say 2 cars collide at a traffic light intersection. A police officer responds to the scene. Now let's say that the police department has a long record where for every 15 red light runners who cause the collision, the police officer only offers 1 traffic ticket, regardless of whether running the red light was an accident or done knowingly. Now let's say in a different scenario, no one ran a red light. There was still a collision, of course. There was no breach of duty of the driver, but the accident occurred because one of the vehicle's brakes failed, or a stray dog ran onto the road, or just some unknown reason why the accident occurred. A police officer responds to the scene. He or she sees that one of the passengers has a serious injury. Maybe it's a child. So he or she gives a ticket to the other driver, and that this is known to occur about 5 out of 6 times in this situation. If these 2 scenarios were our actual reality, we would all be outraged by the system, not just those unfairly getting traffic tickets. We would all demand for traffic violation reform. We would all want some means to hold the system accountable and not automatically the individuals. We would demand a process that screens these frivolous traffic citations and throws them out before they can cause more harm. If this scenario was here on Guam and allowed to continue, who would ever want to drive here? Knowing this, who would ever want to move to Guam to work? Who will get a driver's license here? This is the reality of what medical malpractice is without provisions in place like mandatory arbitration or a screening panel. No one gets into a car accident, no one wants to get into a car accident, just like no doctor wants to harm or lose a patient. Yet, physicians have to practice in this environment every day. An environment that rightfully demands quality and safe care, all while being responsible stewards of the limited resources to do so. At times, it seems society has inflated the ability of modern medicine to be able to nearly cure all and save all. At times, we seem to think disability or even death is optional. If that was true, then no one would ever die. A physician's most difficult duty lies in our ability to understand and assess all the risk as best as we can and not be paralyzed by it. If we reject all risk, then the greater good will never be realized, and society will be left with much, much more pain and suffering. You cannot have it both ways. In finding a reasonable balance, safeguards must be in place to ensure that those who are truly harmed by malpractice have the opportunity to be made whole. This is why medical malpractice can actually never be eliminated, and I don't think it should. But this is why myself and many, if not most of my colleagues, support an amendment to the mandatory arbitration that allows actual victims reasonable recourse to become whole in some form. As important as it is to make these patients whole, it's just as important to do so without significant collateral damage of punishing those who are trying to help during an inevitable bad outcome, like trying to clip an aneurysm in somebody who otherwise would have just died, but you gave them a chance, a fighting chance. So that being said, I think it's actually really important that I take a moment to sincerely express my appreciation for Mr. David Lebowski, for Ms. Annalyn Lagrimas, for their brave testimony during last hearing. I can't imagine how difficult that must have been. In all honesty, as much as I put myself in trying to empathize with them, the reality is that I disagree with many of the statements they made. But that's not the point that's relevant in me saying that, and in what I actually gained from it. Listening intently was incredibly valuable to me as a physician, to try and comprehend their interpretation of what reality is for them, despite the differences in opinions that we may have. I know their hearts are in the right place, and I applaud their effort to try and raise the standard of care for our island. We should all welcome in a responsible way. And standard of care is a legal definition. It's not a medical term that's really used that has anything of significant meaning, because the standard of care changes every day. It changes where you are. And basically it's about reaching to the ceiling of care the best as you can. So on a separate note, as the Chief Medical Officer for GRMC, I would be remiss for not making it known that there are very real and dire repercussions if there was a full repeal to the arbitration law. GRMC is the largest employer and privileger of physicians and mid-level providers in this region. We provide medical malpractice liability insurance for nearly all of our providers under our group plan. Those who aren't, they have their own individual coverage, because you have to have it to practice in our private hospital. So we cannot allow the situation where 5 out of 6 of our good doctors are at risk of having a frivolous lawsuit paid out in their name. All claims settled or awarded are required to be reported to the National Practitioner Data Bank. I estimate that most doctors are significantly more dismayed by the thought of having a hit in their MPDB record than actual financial penalties. I believe this is true because there is no way to be made whole with a frivolous record that could compromise your ability to continue practicing medicine. Lastly, it's worth mentioning that GRMC would never have even come into existence in the first place without the ability to have affordable malpractice insurance. During a past conversation I had with our insurance providers, we discussed the factors that led to our underwriters actually being able to offer us an affordable plan. So in order of importance, this is what was listed. So number 1, that Guam has a history of being a low litigious area compared to the other states. Number 2 was the presence of the Mandatory Arbitration Act. And then number 3 was the volume of physicians in our plan that gave us buying power. If there was a repeal of the mandatory arbitration, you can easily expect insurance premiums to skyrocket, expect the high possibility of good doctors leaving Guam to provide their good care elsewhere. For those of us who remain, expect more pain and suffering. My intention is not to be an alarmist, but to be a realist. It's already hard enough recruiting the talent and skills necessary to substantially elevate the local definition of the standard of care. We've all made significant cracks in this glass ceiling of care for our patients. Please do not let the roof collapse on all of us. So I'll end with a quote by author Simon Sinek. The mind must be convinced, but the heart must be won. I pray that our testimonies tonight have done both. Thank you.
Miss your voice, miss your smile, everything about you worth the while. Always wondering where you are. I hope you're with us, near or far. Many questions unanswered,